Hello, thanks for attending this webinar in which we will discuss how Bioptrone hyperlight therapy can help our elderly. So this webinar will delve into the benefits of Bioptrone hyperlight therapy in various geriatric applications, including wound care, pain management, and overall well-being. First of all, I would like to make a point to let you know that our B2 has been successfully implemented in several nursing homes in France. We started to have a very good feedback from these nursing homes. One of them explained us that the nursing team is surprised by the positive effects. The device is being used by the whole team, and that's very encouraging, not only for the elderly, but also for the healthcare takers. We will be able to continue our progress in research. This directly states the achievement of successfully implementing B2 in these healthcare facilities. This, of course, is not only a new opportunity to develop new markets, but also a fantastic opportunity to help even more our elderly. And at the end of the webinar, you will see that you will not only help medically these institutions, but also economically. But first of all, let's have an overall overview about our devices. As most probably all of you know, Bioptrone hyperlight therapy, it's a family of 3 devices that share the same technology, but the shape is different to adapt to the needs of different patients. We have Medol, that is the smallest model. The filter has 5 centimeters diameter, and it's intended to be used by private patients or people that don't need to go to a clinic to be treated. It's coming with this traveling case in a way it's very easy to use even at home. Our middle model, it's Bioptrone. Bioptrone has a filter of 10 centimeters diameter. It can be used with the table stand, but also with the floor stand. This one is very used in clinics also, but for at home, because it's very light and it's very easy to move it from one place to the other one or from one treating room to the other. And finally, and this is the most successful in healthcare institutions, it's B2. It's our biggest model. The filter has 15 centimeters diameter, which allows to treat bigger areas of the body. It's coming with the floor stand. In a way, it's very easy to use for everyone in this nursing home to move it from one room to the other one, and then even from one floor to the other. As I told you, it's a family of 3 devices, but the light characteristics that will make the effects of Bioptrone, as we will see later, are the same. Which are the light characteristics of Bioptrone hyperlight devices? So Bioptrone hyperlight is polychromatic. That means that the light that it's emitted goes from 350 nanometers until 3400, containing all the visible spectrum, but not the UV. This is very important because we avoid the potential secondary effects of UV, but these different types of light will able to interact with a wide range of biomolecules, extending the scope of the application. Bioptrone light is also incoherent. That means that each wave is following their own way. In a way, the application of light is safe. It will apply a dynamic penetration that will allow this efficient healing process. Bioptrone light is low energy. That means that the light that is emitted by Bioptrone devices is in the range of light that allow to trigger a specific cellular mechanism that we will see now that allows this efficient healing process. And finally, but not less important, Bioptrone light is polarized and hyperpolarized. This is very important because more than 95% of the light is going in the same direction. And this will allow a better penetration in the tissues than interacting with a wider range of biomolecules. And it's the combination of all these characteristics that will trigger what we call biostimulation. The biostimulation are the cellular mechanisms that are triggered by Bioptrone. These cellular mechanisms are the improvement of microcirculation, the reinforcement of the immune system, the stimulation of regenerative and reparative processes that will allow the promoting of wound healing, and it will relieve the pain or decrease this intensity. And this is thanks to the triggering of these cellular mechanisms that Bioptron has a so extended spectrum on care. This is why with this only one device, you can have so many different medical applications. And Bioptron meets the needs of the elderly. As you know, elderly have specific health challenges, as could be chronic wounds, chronic pain, and even skin disorders. And for all these medical domains, these cellular mechanisms are very important. So Bioptron is meeting the health needs of the elderly. But not only that, Bioptron light is very bright. Bioptron light is more than 10,000 lux. And we know that bright light can regulate the biological rhythms. And some studies have proved that the use of light can decrease the depressive symptoms. And this is very important because, unfortunately, elderly can suffer from that. So with the same device, you will be able to face the challenge for elderly. But how is that possible? Now we will see how Bioptron will help all elderly in wound care, pain treatment, depressive symptoms, and even in oral care. So now that we know the cellular mechanisms that are triggered by Bioptron, we will be able to understand how Bioptron achieves this healing process. So Bioptron will help the proliferation of fibroblasts and even the increase of collagen synthesis. This is very important to achieve a faster and more complete healing of soft tissues, including skin, muscles, tendons. So we will allow a regeneration of these tissues and increase the density of the skin. Bioptron acts in different points of the immune system to decrease the inflammation. So it's decreasing molecules that are pro-inflammatory and increasing the molecules that are anti-inflammatory. So this will have a double effect. We will decrease the inflammation, but we will also decrease the pain signals that are sent. Since Bioptron is acting at different points of immune system, we know that Bioptron will help our immune system to fight against external pathogens. This will allow a safer healing of wounds and support this antibacterial effect. As I explained you already, Bioptron stimulates microcirculation, which is very important also for the healing process. So Bioptron, thanks to this vasodilatation, this improving microcirculation, and this proliferation of fibroblasts is allowing these regenerative processes. In a way, we can have an accelerated healing. And since Bioptron is helping to produce collagen, it's also avoiding the hyperscarification and the appraisal of keloids, that are these big wounds that can stay in relief and can be very painful. So it's the combination of all these effects, cellular mechanisms that are triggered by Bioptron, that we get this healing process. And now that you know how Bioptron works, let's see how it will work, not only for the wounds, but also for the depressive symptoms. Because as I told you already, Bioptron can fight these depressive-like symptoms thanks to the bright light by regulating the circadian rhythm. So how to use Bioptron? Bioptron is very easy to use. It's painless. The way to use it is to put the device at 10 centimeters distant from the region that you would like to treat, a wound, a painful area, for 10 minutes per session. The ideal is twice a day. So one in the morning, one in the evening, for as long as needed. So as long as the wound is open, as long as the patient has pain, etc. And which is very important, as we will see, it's compatible with other pharmacological and physical treatments that will help with the overall well-being of the patient. Now I will show you some studies that we have for these medical domains. Of course, not all of them, because Bioptron has a lot, but it's to make you, to give you an idea about what Bioptron can do, and to show you that Bioptron has strong clinical trials behind that prove its effects. So let's start with wound care. Something that the elderly are facing very often are these chronic ulcers, in general diabetic foot. So people that are diabetic that have a lot of problems to heal the wounds. In that study, they have two groups. One of them, they were testing the standard treatment for wound care. And in the other one, they were testing the same wound care treatment plus Bioptron. They were using Bioptron 3 times a week, 12 minutes per session, and then they check what happened 2 months later. So and what they measured was the surface area of the ulcer, but also the volume. So let's see what happened. For the ulcer surface, you can see here the results of Bioptron in blue before starting the treatment and 2 months later. And this is for the group that did not receive Bioptron. As you can see here, at the beginning, it was no difference between groups. But after 2 months, the surface of the wound with the group that was treated with Bioptron decreased in more than 40%. And in the group that did not receive Bioptron, decreased in around 25%. So almost the half. And something similar happened with the volume of the ulcer. At the beginning of the treatment, both groups have more or less the same volume of the ulcer, but after the volume of the ulcer decreased quite a lot in both groups. But in the group of Bioptron, the volume of the ulcer decreased more than a half, so more than 56%. And in the group not treated with Bioptron, it was almost 32%. Here you can see some examples about this healing of the ulcers in the Bioptron group and in the control group. So you can see that the ulcer is much more healed 2 months later in the group that was treated with Bioptron. But these researchers, they don't stop there. What they check is, okay, the problem of these wounds also is that they can be infected because they are so long open that this can produce other problems. So they check which bacteria were present there and in how many patients. And you can see here that in the group of Bioptron, 40% of the patients were positive for some of these bacteria. And in the group that was not treated with Bioptron, 85% of the patients. So Bioptron hyperlight therapy is an effective treatment decreasing the ulcer microbiota. So we are decreasing the microbial infection, but also in parallel, it's very useful decreasing the wound size. And very important, and a very important point that these researchers highlighted is that not only Bioptron is very performant healing wounds, but it's very safe. They declared in this article that no harmful effects or reactions were observed during the trial when using Bioptron-like treatment, which is supported by other clinical trials. In another clinical trial, they showed something very similar, but in that case in pressure ulcers. So as you know, elderly people, sometimes they cannot move. So they have the weight of the body in the same points, and this can cause these ulcers. So in that case, they did something similar, 2 groups of patients, one of them that was receiving the standard treatment only, another one the standard treatment plus Bioptron. They were using for 10 minutes, twice a day, during 1 month, and they checked something similar, the ulcer surface and the ulcer volume. And you will see that they arrive to the same conclusion. For the ulcer surface, after 1 month, the group treated with Bioptron, the surface of the ulcer decreased more than 46%, but the group that was not treated with Bioptron didn't change. For the volume, something similar happened. The group of Bioptron, the volume decreased in 55%, but the group that was not treated with Bioptron didn't change. So once again, Bioptron was very significantly effective in enhancing the healing of the pressure ulcers. Of course, I cannot show you all the clinical trials that Bioptron has, but here you have a list of clinical trials done by medical doctors that show the positive effects of Bioptron in different types of chronic wounds, venous ulcers, pressure, diabetic foot, after surgery, etc. But not only that, of course, we have a lot of feedback from people that were using already Bioptron. And then I will go through very quickly because most of you know all these cases about how to use Bioptron in post-surgery scars. We have a lot of cases in which they show the positive effects of adding Bioptron to the wound care treatment that they use. Also for diabetic foot, we have a lot of cases in which the use of Bioptron allow to close the wound, to decrease the inflammation of course, the pain that these people have with these chronic wounds. For elderly, is very known also these venous leg ulcers due to bad circulation. We have a lot of cases also from nursing homes that show how effective Bioptron is. This is also very positive because these people in general, they have quite a lot of health problems, diabetes, hypertension, Parkinson, Alzheimer. So they have their own treatments, and it's very, very, very difficult to introduce a new treatment that we need to be sure they don't interact with these treatments. So it's very important to know that Bioptron can be used very safely in that cases because it will not create side effects. Also for pressure ulcers, as we saw. So not only Bioptron will help with chronic wounds, but it will also help in the pain management, so decrease the chronic pain that unfortunately the elderly are suffering also. I will show you some cases, some clinical trials in which Bioptron was very helpful, helping to decrease this chronic pain. One of the pathologies that our elderly are suffering is the osteoarthritis. So the osteoarthritis is the most common form of arthritis. It's a degenerative disease that worsens over the time, resulting with chronic joint pain, stiffness, and unfortunately, they are not acute. We can only deal with this. So in that case, what they did is, once again, separate people into groups. One of them received Naftalan, that is an anti-inflammatory cream with anti-inflammatory and anti-pain properties, and another group with Naftalan and Bioptron. And they treat, sorry, and they treated the people at 20 centimeters distance for 6 minutes, 5 times a week. And what they checked, it was different tests. I'm very sorry. They have different outcomes, like this Oxford Kidney Score, this index WOMAC for arthritis. So they did different tests, and we will see the results of each of them. So, of course, the most known is this VAS, so they will check if the people have pain or not. This is the same that what we see before. Here you see the Bioptron group, and here the group that was not treated with Bioptron before and after the treatment. So you can see that in the group that received Bioptron, they decrease in more than 26% the pain that they feel. But the people that were not treated with Bioptron, they have the same pain. So Bioptron decreases the pain. Also, one problem that the elderly can have is that they are not able to walk properly because they have pain. So in that test, they need to walk 15 meters and they check the time. You can see here that thanks in the group that were receiving Bioptron, it took them less time to go through these 15 meters. They decreases in 20% the time. But the people that did not receive Bioptron, they were taking the same time because they were having pain. So Bioptron will allow the mobility of these people. Also in that test, this Oxford Kidney Score that will check the function and the pain, you can see once again that the group that received Bioptron decreased the pain, so they were more function and less, they were having more function and less pain in around more than 20%. the same for this WOMAC arthritis index. They showed that only in the group of Bioptron, it was a decrease of 13%, which shows that it improves the pain, the stiffness, and the functional functioning of the joint. So these patients were able to have less pain, which allowed them to move better and, of course, to have a better life. Something similar in this other clinical trial about low back pain, that unfortunately is something that it's very extended. So in that case, it's more or less the same way to work. So there is a group that received the standard treatment and another one that received the same treatment plus Bioptron once a day for 10 minutes. And they did a specific test for the low back pain. So in that case, it was the Tomayer test, the Schober, and the quality of life and pain. And we will see the results for each of them. As you can imagine, when they check the pain, they see in the group in yellow, it's the group of Bioptron. You can see how the score of pain is, of course, lower from the beginning in the Bioptron group. So once again, we show that Bioptron decreases the pain. Something similar in this Roland Morris Disability Questionnaire, so is how the elderly feel themselves related to the pain. And you can see that from the very beginning, of course, both groups decrease because they are receiving a treatment. But the group that received Bioptron have better mobility, so they were feeling much more better. And something similar happened with these other two tests about mobility. This Schober test that show that there is, of course, a tendency of better results in the Bioptron treatment group. So they will be able to move some centimeters more the back than the people that did not receive Bioptron. So Bioptron improves the flexion of the spine. And also in this Tomayer test, in which Bioptron allows a greater declination of the body. So as you can see here, the score is smaller because these patients were able to move the whole body. Of course, our elderly, unfortunately, are suffering from other chronic pain, and Bioptron is medically certified for all these chronic pains related to rheumatoid arthritis, osteoarthritis, low back pain, neck and shoulder pain. As I told you, Bioptron has an extended list of clinical trials, and all that are, of course, showing the positive effect of adding Bioptron of the treatments that you are already using. So it doesn't mean that you have to change everything, but if you're in nursing homes, you have a specific treatment for wound care or for pain, you can keep going because you know that that works. But adding Bioptron will be a really a plus, as we will see, without side effects, without interacting with other treatments, and of course, helping the patient. So now we will see how Bioptron can help to fight against the depressive symptoms and in oral care for our elderly. So Bioptron is medically certified for seasonal affective disorder. That is a type of depression that comes for seasonal pattern. This is why it's also called by winter depression. The symptoms are like the depressive symptoms: low mood, loss of pleasure, they are not feeling okay, they want to sleep much more. For some people, these symptoms can be very severe and have a very negative impact in their lives. So the good news is that with the same device, you will be applying very bright light, so more than 10,000 lux. And this is very similar to sunlight. And this is a very advantage because Bioptron really mimics the sunlight, and it's very close to the current light that we receive in summer, and this will be very useful. So we know that Bioptron will help to regulate the circadian rhythm that will help to decrease these depressive symptoms. The way to use it is a little bit different of what we have seen until now, because the objective is not that the light goes directly to the head, but close to. So the recommended treatment times are between 20 and 40 minutes at a distance of 20 centimeters. If you would like to put more distance, like 30 centimeters, then you will need to apply more time the device, and a distance of 40 centimeters for 1 hour or two. The idea is 1 or twice a day. If you can do it only once, then it's better in the morning, and then as long as needed. So you can use it in the morning for all the winter or all the time that the people is depressed. The way to use it is a little bit different because your eyes needs to see the light without watching directly. So what I can advise you using with elderly is that when they are doing an activity or if they are watching TV, then you put the device close to them. In a way, the light is going through the forefront or from the side. In a way, their eyes are able to see the light, but without watching out directly. I will not explain you so much about the clinical trials with for depressive symptoms because we had already a webinar about that. You can have a look. But what I can tell you that it's coming from the scientific literature is the light treatment is the treatment of first choice, for example, for seasonal affective disorder, for young, for adults, and for elderly. There are other therapies like this cognitive behavioral therapy, but this is very difficult because it takes a lot of time. With elderly, it's very difficult to do it. So it has been shown that 6 weeks of this CBT, 1 hour and a half per session, twice a day, it has the same effect that 30 minutes of bright light in the morning. So, of course, with elderly, it will be much more easy. Other option is the antidepressant medication, but this can have a lot of multiple side effects and could be not compatible with the treatments that the elderly have already. So what we advise you is light therapy with bright light, 10,000 lux for 30 or 40 minutes per session will have very good results. It can be used as preventive. There are some clinical trials on that, but in a nursing home, perhaps it's difficult to do that. Anyway, you need to know that the light therapy is a very effective treatment also to fight against this depressive symptom. And finally, we will see how Bioptrone hyperlight therapy can help our elderly for oral care. Some of them, they can have pain in the oral mucosa for different reasons. So in this clinical trial, as you see, they always use this standard treatment that they have. And in the other group, they add Bioptrone. They were using it only twice a day for 15 minutes per session for 2 months. And then they check the pain, of course, but also the improvement of the symptoms by this Eisen score. I know that this is a very complex graph, but I would like to show you is that in blue, we have the group treated with Bioptrone, and in gray, the control group, so without Bioptrone. You can see that over the time, this pain score was decreasing. So people that were treated with Bioptrone, they have less pain. People without Bioptrone also, but this different, it was always much more important in people that were treated with Bioptrone. So they have less pain from the very beginning. And then also an improvement of the symptoms. You can see here, at 1 month or 2 months of treatment, that the people that were treated with Bioptrone here in blue, they have a very improvement in the symptoms, and the people without Bioptrone less. So Bioptrone decreases the pain faster and provide a significant improvement of the symptoms. So people will help better. The symptoms of the oral problems will decrease, but also they will have less pain. And of course, other pathologies that are suffering the elderly in the oral care are the periodontitis. So we have clinical trials that show that for the periodontitis, Bioptrone helps with the decrease the bleeding, decrease the gums inflammation, and they have less pain. Also, in the cases of mucositis, so inflammation of the gums, the same. Bioptrone improved the plaque index, so they have less plaque, less inflammation, and of course less pain. So I think you have a lot of medical proof and scientific proof about the good use, about the positive effect of Bioptrone. But also, of course, nursing homes are looking for meet the needs and the challenge that they are facing. Of course, there are the needs of the patients, but also the needs of the healthcare institution. And as I told you from the beginning, I will show you the positive effects of the patients, but also for the healthcare institution. As you have seen, Bioptrone has a lot of medical positive effects. So, of course, you will have an improved patient outcome. The patient will be able to return to normal activities better, and they will have better health outcomes. Since we are preventing, for example, infections, wounds, more pain, you have like a preventive care. In chronic condition, preventing these complications that will be more expensive for the healthcare institution will decrease, but also decreasing this future complication, it's improving the health state of the patient. Of course, if they feel that they are improving better, we will have this patient satisfaction and compliance. The patients will stick much more better to a treatment that is easy to use, that is painless, and they will accept to be treated with Bioptrone much more easily. And of course, they will have better health outcomes. So that meets the patient needs. We will help the patients, but also the healthcare institutions, because they will reduce the cost. Of course, they reduce a medical expense, because if you are accelerating the wound healing, you are decreasing the pain. You will decrease, of course, the medical costs, the personnel that will need to take care of the patients to provide these treatments, etc. So this, of course, will have an economic positive impact in the healthcare institution. You will reduce also the need of invasive procedures. So, of course, if you are avoiding complications and you are avoiding that the state of a patient is degraded, you are saving in other more costly therapies or even long-term therapies. And then with the same device, you can have different purposes. One patient will need to be treated for a wound, the other one for pain, the other one for mucosal problems. With the same device, you will be able to treat all of them. So Bioptrone will meet the needs of the patients from a health point of view, but also the one of the healthcare institution from a health and economical point of view. And I will put you a simple example before finish. Let's imagine that you have a nurse home with 50 residents, and 50% of them, so 25, they are suffering from chronic pain, and 20% they are suffering from chronic ulcers. So this is an estimation. So let's say that more or less per year, the standard care for chronic wounds will be like 55,000 euros per year, including the doctor visits, the dressing, the medication, the clinic stay, etc. And also, of course, the standard care for chronic pain management, like including pain medication, physical therapy, medical interventions, etc. So let's say that there is a budget of 255,000 per year. Now you will buy Bioptrone devices. Let's say, for example, that you will buy 10 Bipro one at around 2,000 euros, because of course we will offer you a 25% off, or to be choose at 10,000 more or less, with taking into account more or less 25% off. This will be an expense of 20,000 euros, but you will have it for one time. Okay. So then let's say that the first year you have this budget of 255,000. Then you decide to buy Bioptrone and to start 2025 with these Biotrones. Then we have estimated that you will, of course, reduce the doctor visits, because we know that there is more or less a wound acceleration of 50%. So you will save around 10,000 euros per year. Of course, you will have a reduced medication for the people suffering from chronic wounds, but also for pain in around 50%. So 30,000 euros per year. Reduce of physical therapy, not only for the machines, but also for the personnel, 30,000 euros per year. And you are avoiding longer hospital stays longer medical intervention, or even more expensive, for around 65,000 euros per year. So you are saving all that. That means that at the end of the first year, you will have 150,000 of savings. So your budget will be 140,000 euros because, of course, you had the expenses of Bioptron. But this is the first year. So from the first year, even if you are investing, you are already saving money. And from the second year on, because your devices will stay with you, so you can use it for years, you will have a budget of 120,000. So you are saving 135,000. So this is, of course, an estimation, but what we want to highlight is the cost reduction with not only improved resident care, but also with potential better outcomes. So you will be providing better healthcare to your patients, but you are also saving money for the healthcare institution. So I would like to help you to attending this webinar. I hope you have a global idea about Bioptron hyperlight devices, not only how that works, but also that you keep in mind that Bioptron is a medically tested and clinically proven device. So we have an extended list of clinical trials. The effects are very effective and long-lasting without known side effects. So it's very easy to use in elderly that needs all this global treatment for other pathologies. Of course, there are people that can come back home and be treated at home, but you can treat them, all of them, in the institution. It's very comfortable, easy to use. You can move it from one room to the other one with very short treatment of time. So you can treat a lot of patients during the whole day. Can be used in every department. You can move it from one room to one department to another floor. It's a Swiss-made medical device, which is a proof of quality. And as I show you, it's an economic therapy, because even if you invest from the minute zero, you are already making economical savings, but you are helping your patients. So I hope you enjoyed the webinar. Thank you very much, and help as much as you can our elderly. Have a nice day. Bye.